Texas. And he's going to speak on site-specific applications using various fillers.
Okay. Thanks, Jonathan. I'll probably be lecturing on behalf of Medicis this coming year, but I will be donating the fees over to the Academy, so I'm not taking any consulting fees. This is a lady on the left who actually had her lines and lips filled by another doctor about a week before this photo was taken, and she was coming up for reunion. So I did my standard volume fill using cannulas, and I filled 1 cc of Restylane under each eye. I used a little bit of that to actually balance her lips. Randy Waldman gave a good talk yesterday. And what I did was I just sort of gave her that little cleft in the bottom lip. It just makes it look a little less tubular looking. And then I did a ½ cc of Perlane into each anterior cheek. And then I did a ½ cc of Perlane into each anterior chin pre-jowl. So it's 4 syringes, 2 Perlanes, 2 Restylanes, all cannula injected to place that in there. It's much smoother, the bruising goes down a lot less. There's much less chance of having arterial issues with it because you're not hitting anything. And I think it's especially very safe around the periorbital region. So the other thing is I always say, a lot of times when you see these before and afters at the meetings, you're always seeing these close-up of the nasolabial fold or a little ditzel here. I always say, look at the whole face, because that's how you judge each other. So women are very focused on the little lines, this and that. I try to bring them out of that and let them see their whole face, because that's how people react to each other, is the whole face. So I say, get yourself away from that close-up mirror, and that's what I do with volume now. I'm really looking at volume restoration, not focusing on the little lines, but really creating, this is all fat grafting, by the way. So these are just to show you how I basically preview my fat with my fillers. Because people say, well, you know, you get them in your practice, you do a great nasolabial fold, they're going to have their facelift done. Well, how does a nasolabial fold relate to a facelift? I think the volume fills give them an incredibly good preview of what fat can do. And to me, that's a very nice extrapolation. So let's go back to fillers here. These are a couple more examples using the 1 cc of Restylane under each eye. And actually for her, she's got a heavier jawline or heavier jowl, so almost everything went into the pre-jowl, very little went into the anterior chin. If you do a very skeletal person, I put more Perlane into the anterior face of the chin to cover that bone. Another lady where perhaps when you look at her on the left, you're tempted to look at her labial mandibular folds, you're tempted to look at her nasolabial folds and look at that as the problem of correction, but once again, I didn't touch that. I filled her under eyes, I filled her cheeks, and I filled her chin. Same recipe I gave you earlier, and you're welcome to come and ask me afterwards. This is Restylane using cannulas. I don't think you need cannulas in the hands, but I did a cannula to fill. Let's talk a little about RADIESSE. I don't use as much RADIESSE. I'll tell you about how I use these products toward the end. I think it's a great product though. It's December 2006 FDA approved for nasolabial folds and HIV-related lipoatrophy. I think you know most of these products. I don't need to go through all of that, but it is something that is biosynthetic and biocompatible and biodegradable. There's a tissue infiltration period that occurs over 3 months so that as that comes in, you're not going to really feel the product. People say, I don't feel the product anymore after 3 or 4 months. And that is unique to RADIESSE. You usually still feel that Perlane for the time of the duration of the product, but there's limited palpability over time. It's something important to tell your patients, because they're going to come and tell you, hey, the product is gone. You take their photo, you go, no, it's not. It's still there. I can see it. It does last quite a long time. Maybe 5 years, I was talking to Steve, I think president or some other company was saying that's not quite right, it's not this long. I think it lasts a long time, I think it lasts a long time in the body. But it doesn't emulsify and calcify if you put it away from bone. It's basically made of a gel carrier, and as I said, at 3 months, you could lose a little bit of the effect at that point, because as the tissue ingrowth is occurring, you may not get a one-to-one exchange of loss of gel carrier and infiltration of tissue, and at that point you may need a little touch-up. It is prepackaged in 0.3 and 1.3 cc syringes. There's no need for reconstitution. These are the things you guys know about. I don't need to go through all that. This is again, the dirty lie. I truly believe this needs to be placed in the subcutaneous plane. Especially now that we're moving more toward volume. It makes no sense to try to hug that deep dermis. If you get a problem with this, you're in deep doo-doo land. So I will tell you, stay subcutaneous. If you're getting great results intradermal, fine. I'm not here to ask you to change. But if you're just starting with this product, I see no reason to go intradermal at all, period. And remember this other thing, I had some problems a few years ago when I started, was as your needle comes out, just make sure you stop before you hit the dermis because you're going to inject intradermal. Always, it's a very moldable product. It's very moldable. And remember, when you massage that product where you want it, massage into the area you want it. Don't massage it out of the area. I mean, squeeze it in like this instead of doing that kind of action. It really will get it where you want it to be. Where do I do it? I use it for deep volume fills in the cheek and jawline. I use it for deep folds and lines, and I use it for hands. And I don't like it in the periorbital region. I think, as I hate to, Val Lambros mentioned, is you got to be nuts using this around the eyes. I want to be careful with that. If you're getting great results, fantastic, go for it. I think there's a risk profile around the eyes that is higher. And if you're a novice injector, perhaps don't go there. This is just the nasolabial fold for a relatively deeper fold. I think this is much better with RADIESSE. This is JUVEDERM around the eyes when I was doing more of that, and RADIESSE into the cheeks. That's 1 syringe of RADIESSE into the cheeks, split halfway. This is about 4 syringes of RADIESSE being used for HIV lipoatrophy. This is 2 syringes of RADIESSE into, 1.5 syringes of RADIESSE into each hand. This is done with a needle injection, and it's using that lidocaine swish you heard about to allow it to smooth better. Polyl-lactic acid I really don't use very much anymore. It's FDA approved for HIV lipoatrophy. I think a lot of these things you already know about. I'm going to go through the details, but to use a great dilution of it, I use about 5.0 Cs with a lidocaine. I mix it the night before. And the key, inject it subcutaneous. That's the key here. And you got to wait. And this is the thing, part of the reason I don't really use it much anymore now is that patients need a lot of this. And you need to wait a long time before you see a result. And a lot of patients want the result yesterday. And that's part of the reason I don't use the product much anymore. I'm running out of time here. So the benefits of this I really believe is in the mid-face, in the chin area. Obviously not in the nose and the lips. Periorbitally you can do it. Again, I think there are some limited risks with it, and I would encourage you probably to stick with the mid-face area with SCULPTRA. But if you're good with periorbital in the depot fashion, you're doing a good job with that, fantastic. I just would tell you, probably if you would, stay away from it. This is just an example of SCULPTRA. So the overall I use everywhere. I think it's a fantastic product. It's really good for almost everything in my opinion. It's reversible. The calcium hydroxyapatite, fantastic product for deep volume, deep lines, hands. I don't do it for periorbital regions. The reason I don't use as much is because I do a lot of fat transfers. I can't convert someone from calcium hydroxyapatite. In other words, I can't dissolve the product and move them over to fat. Lactic acid, as I said, part of the facial use, and there's some contraindications, but it takes a long time for the patient to see the result based on the cost. So I'm out of time here. I appreciate your attention, and that's the dirty secret, which is stay in the subcutaneous plane. That's a book on fat transfer, and that's it. Thank you, guys.